Yeah, we going up, we going crazy, going bonkers. Produced by Ziggy, Zay Ticky, believe that.
It ain't peaches, it'll deceive you, boy, believe me. What you know about a jungle made with nothing but semen. No creepy crawlers, just heathens that prey on your weakness. Smell the slightest hint of fear, and the stainless you'll eat it. Gang bangers that greet your test on their face like Weezy. Pouring milk by the ounce, walking around looking sleepy. I'm from a town, no integrity, a broken city, disrupted. I know niggas who once were real, who now turning into sucks. When it comes to murder, it's nothing. Rallos get pulled over scuffles. Bumpy road around this motherfucker, your life means nothing. It ain't peaches. Niggas walking around with no feelings, with a chip on their shoulder, saying the world don't feel us. Trying to earn them some millions so they can split with they niggas. I know cats that died broke because they lost all ambition. When it comes out to get
Welcome back. Welcome back. Another edition of More to Live For. It's still May, so we're still highlighting queens of the city, near and far. Tonight, I got a special young lady with me. I'm going to let her introduce herself and give her a little spiel about herself, and we're going to kick it off just like that. How you doing, ma'am?
I am well. How are you today, Ernest? Or tonight, I guess.
I'm doing all right. I'm doing all right.
So I am Dr. Markia Camper. I'm from Greenville, North Carolina. I just graduated from Howard University College of Dentistry last year. Smack dead in the middle of COVID, but I made it.
That's what's up. That's what's up. And that title just sounds so wonderful. Hearing somebody that you know say doctor. And you know, this just goes to show what I've been doing with this whole segment is highlighting queens, but I can't help if I went to high school with them. So that's what has really been this whole journey that I've been going on. So definitely thank you for doing this for me. And I figured we go ahead and kick it off. The first thing that I wanted to know personally is, you know, what made you want to get into this field, and was it a popular field, or how did that come about?
So I will begin with saying less than 1% of Black women are dentists. I'll start with that. And roughly 3% of Black men are dentists. So what made me get into dentistry was when I was 8, that was my first dental appointment with Dr. Hazel Brown. And she works out in Greenville. She went to Chapel Hill, actually. Okay. And I just remember my mom just being excited to see a Black dentist. And at the time, I didn't know what I wanted to do when I grow up. And, you know, at the age of 8, everybody's asking like, oh, what do you want to be when you grow up? And
right.
Literally my response was like, oh, I'm gonna play. And they were like, what? And my mom said, don't ask again. She is serious. She plans on playing her whole life. And so Dr. Brown was like, so what are you gonna play? Like sports, an instrument? And I was just like, what is she talking about? Like I told her what I'm just gonna play.
Right. I think I had her, I think I went to her before. I didn't mean to cut you off.
No, you're fine. So yeah, she ended up telling me like at the end of the appointment, like if you don't ever figure out what you want to do when you grow up, you can just become a dentist like me. And I was like, oh, okay. And so like every appointment, she would just like talk about becoming a dentist. And like I said, I just remember my mom lighting up when she saw a Black, you know, female dentist. So that kind of just stayed in my mind, you know, in the background of my mind or whatever through high school and stuff. And then even after graduating high school, I was like, the only thing that comes to mind to be is just a dentist. So I went for it. It took a while. It wasn't easy, but I stayed on course.
I heard that, and big ups to you. Could you explain the process, you know, like with, you know, once completing high school, like the next steps to pursue?
Yeah, so this comes with any health profession. like career, whether it's medical school, dental school, veterinarian school, physical therapy, occupational therapy, whatever. So once you graduate high school and you go into college, you pretty much are on the like college prep track. And the easiest route, and the reason why I say easy is because those are the prereqs that you're going to need to further your education and help the health profession field. So I would say biology, you stick with like the sciences. Not to say you have to get a degree in a science. You can get a degree in another area like accounting or finance or something like that. But then you have to also just make sure you get your prereqs for that field. And it's usually like biology, chemistry, physiology, anatomy and physiology, then various math like algebra, calculus, statistics. Yeah, a lot of science and math courses. And gotta, in a sense, like maintain like a certain GPA. That plays a factor, but it isn't like the only thing to say. Like, say for instance, somebody feel like they have like a 3.2 or maybe a 2.6, 2.7 or something, and they wanted to be a doctor, and somebody tells them like, oh, I don't think you can be a doctor with a GPA like that. There's other things you can do, like a post-bac program, which is just going, and they're very specific programs you have to like seek after. So you will retake classes that you didn't do too well in. And say if you got a C in a chemistry, you retake those classes and get an A, and it kind of factors into your overall GPA that you got from undergrad, which will boost your GPA up higher. Or you can take the route that I did, which was go for a master's. If and people tend to do this if they applied and didn't get accepted the first time. That's just a way to look different on paper. So you either do a post-bac or you go for a master's. So I went for a master's in physiology when I didn't get accepted the first time. But the thing was, I didn't know much about applying. It's a long application, like online. And so when I graduated undergrad, it was probably October when I decided to look into the application, and I saw that the cycle was open, and I was just like, oh wow, the cycle's open. Oh wow, it's October, November. Oh, it closes in December. So I'm just rushing, trying to get stuff in instead of like, sitting back that year and just figuring out the process and then applying the next year. So the first time I applied was literally a waste of time and money, like a lot of money.
Right. But you stuck with it.
Literally. So I would say also get a mentor. That's something I didn't have early. A mentor will like help guide you on that path, because it can end up a long, daunting path, honestly, if you're doing it alone. And I found Dr. Abdul, which he passed away in 2015, I believe. He was actually, Dr. Hazel Brown was actually his mentor, which I didn't know that back then. It's just like in conversation, he told me that. But Dr. Abdul became my mentor and just kind of helped me like put things in order, gain perspective of the application cycle, and just having a dentist, like actually have your back, and just like when you need letters of recommendation, things like that. Like he was well known in the community. He can just call up people, things of that nature. So having a mentor early is something that's like really important, and one of the things I wish I did have. But yeah.
Okay. That's very well put. One of the main reasons why I asked you to be a part of this, I'm highlighting women, but for my daughter and other little girls out here, just to see you and see you, succeed at the highest level. And, people, like you said, a small percentage of Black women and Black men that choose this profession, and to see you, shining in it is, such a sight to see. So once again, thank you, ma'am. And I did have a few questions that I kind of wanted to ask that I never really, had to had the opportunity to ask a dentist at all, you know, and to have one that I went to high school with and being a part of this special project with is pretty cool. So I figure I'd give it a shot. So what I always wanted to know, you know, and this goes for, you know, my kids and any other kids, like, is there a certain like procedure that's followed, like when you're dealing with a child with special needs, or is that like something that, you know, like,
So I wouldn't necessarily say like a certain procedure you follow when with dealing with a child with special needs. But the pediatric dentist is the best route to take with a child with special needs as well as with adults with special needs because in their training, they actually learn how to work with kids and adults with special needs and or medically compromised.
all right.
Um, so not to say that a general dentist wouldn't be able to help, um, but their training and learning will come like more so like a hands-on experience. Like a person just kind of walked into the office, they have a special need child, and it's almost like, let me see if I can handle it. If I can't, I'll recommend you or refer you to a pediatric dentist. But like I said, they're trained and equipped to work with special needs community as well as they have things in place like if something goes wrong. Um, for instance, I'll say most times a kid with special needs will tend to have like a lot of decay or caries build up in their mouth because they sometimes are on a lot of different medications. And with that being said, dry mouth is one of the main things that occur when a person is on a variety of medications, which can lead to decay because saliva actually helps to minimize the amount of decay that can build up or kind of wash away the sugar and stuff on your teeth. So once your mouth is drying out, it's kind of hard to kind of maintain that, you know, almost like wet atmosphere in a sense. But yeah, that's pretty much what it is. So um, a kid can end up with literally every tooth in their mouth just decayed in some sort of capacity or whatever. So they have the OR. They have medication that they can give to kind of put the kid to sleep. They have nitrous oxide, which to kind of, you know, mellow them out a little bit and give them, and it boosts their pain tolerance as well. Um, something to kind of, and it also has a kind of a amnesia effect in a sense, like they won't quite remember what happened when they're on the, not the anesthesia, but on the nitrous oxide. So that's good in a sense because they won't be traumatized by like a lengthy, like hectic procedure. So yeah, in short, pediatric dentist is like the best way to go when it comes to special needs.
Okay. And like I said, you know, these are questions that, you know, I wanted to know personally, but I also think that, you know, they're helping you know, other people as well with your answers, and very good answers, I must say. So another thing, like I said, that I personally want to know, like, is it, how can I put this the correct way? What would you say like the most challenging procedure that you've performed or that you've been a part of in your profession?
I was going to say a root canal on a molar tooth, but I'm gonna have to go with darn it. I just did this procedure. Crown lengthening. Crown lengthening is like, say for instance, someone like their tooth is broken off at the gum line, or they have a tooth in the back, like a molar tooth in the back, and part of it is still up under the gum line while the other half is like visible. Um, you perform a crown lengthening procedure, which is you cut a flap open, so it's like a rectangle around that tooth, and you pull back the gingiva, or you pull back the gums, and then remove bone around that tooth, and then you stitch up the flap. But It sounds simple.
It doesn't. It doesn't sound simple.
But it's very precise. Like you're using, it's called a 15 blade. So you're literally using a blade and you're just cutting around the tooth, dropping down, coming up and around. Then you gotta cut a releasing flap in the back behind the tooth. You have to worry about the nerves and other blood vessels running alongside your teeth. It's a lot to worry about.
Oh, yes,
A
it
lot of
is.
bleeding, a lot of saliva, a lot of mess just in the way. But yeah, so you suture or stitch the flap back, and in a couple of weeks, patient come back in, look at the gums again, make sure they're healing well. So the overall point of that is to have more tooth structure visible so that you can potentially like crown the tooth or pretty much crown the tooth so that the patient or the person can have like a actual full size tooth in their mouth. And it comes with like root canals. Some people end up with like the whole crown being, gone at the end of the root canal because most of the crown is decayed, and then you're left with like that nub. So then you do crown lengthening to kind of lift that up so that a crown can fully seat onto the tooth and so it can retain the tooth or the crown. Yeah.
Yeah, that sounds like a very long process. Um, Another question, and this kind of, I wouldn't say personal, but I noticed that, as I get, closer to 40, and some of my friends already are 40, I'm noticing that, myself, I experienced it a few years ago, but a lot of my close friends and cousins my age, like it's like everybody's all of a sudden having tooth problems out of nowhere. And a good friend of mine, he's the same age I am, and he still had his wisdom teeth. Like, is that something that's like that you really only see like with our culture, or is like that's everybody? Because I really don't hear of other friends like saying something about wisdom teeth like when they're close to their 40s or something like that.
Well, I still have all four wisdom teeth in my mouth as well. But it's odd. I'm not gonna say it's odd. One thing about wisdom teeth, they are the last teeth to come in your mouth. They erupt around the age of 17 to 21, but they can start to come in a little later than that. The other issue is that they might not fully erupt into the mouth. They're called like impacted teeth, so they can be like fully impacted, partially impacted, bony impacted. So that means like they're under the gum line, horizontally pushing into the tooth beside it. That's fully impacted. Partially impacted, they're pushing into the other tooth, and you just see a part of the crown sticking out from, sticking above the gums, and is leaning on the tooth in front of it, decay in the back of that tooth. That's a common one that I see. That's partially impacted. And then bony impaction is like it's turned the other way into your jawbone. So we get older, pain tolerance is not high.
Right, right.
We're getting older, and the tooth is partially visible, and you can't quite get back there with brushing. So you're literally just not hitting that tooth, and it's just decaying. And sometimes like people don't notice it. And the biggest thing you'll hear is like, oh, I thought I was brushing far back, but you pull their cheek, and like the whole side where their cheek is just decayed. Like the tooth is just decayed because they're really not getting back there. Like food is just sitting back there, eating the tooth up over time. So it's a variety of things that can cause the wisdom teeth to go bad, or any tooth of that matter. But you specifically mentioned wisdom teeth, but
Oh
yeah,
yes, that's what I hear
things,
about.
yeah, a variety of things, and it's not just our culture. Where I work currently, I'm in Pennsylvania, and it's at a FQHC, federally qualified healthcare center, like the Bernstein building in Greenville,
Okay.
pretty much like that. And the population here is Caucasian and Hispanic population, then a handful of African American patients, but majority Caucasian. And I haven't seen this until I moved here, but a lot of them need dentures. They're like 20, 30, 40 years old. They're getting like complete dentures, or they're missing all their back teeth. A lot of the patients are on drugs, like hard drugs.
Yeah, I know that plays a lot, with the whole tooth decay, and even people in our culture, drug use will take out your teeth. So
Yeah.
that's
Yeah. And the saddest part is watching them come to the realization, like, oh, was it the drugs I was doing 10 years ago? Or is it the drugs I was doing? I just stopped doing drugs. You think that's what happened to my teeth? And their whole mouth is gone. And you're like, oh, you think that's what happened to my teeth? Yeah, that's what happened to your teeth. And I'm like, at the same time, even with people when they're on like heroin or coke or something, like something strong, your teeth are the last thing you're worried about. Like, you're not thinking about your health.
right.
And so when you see these patients come in and now they're like clean, or they've been clean for like I seen a patient today, she told me she's been clean for 14 months. All her teeth in the back are gone. And she's just like, can you straighten my teeth in the front? I'm like,
Wow.
honey, we gotta worry about you missing all these teeth in the back, and you want me to straighten your teeth in the front. But and then she came out with it. She was like, yeah, I was doing drugs, and I know it took my teeth out. My dad said he'll help me, get my smile back and things like that. And she was just kind of beating herself up, like with the things she was saying. And I just had to stop her. And I'm like, listen, you already made the first step, like you're here. So let's not live in the past. Let's not think about what you used to do. I said, you got to just keep moving forward at this point. And I'm like, and you're on the road to recovery. That's all you can ask for right now. And then she was just like, I really thank you for saying that. I appreciate that. And I was just like, if you start to feel that way where you got to tear yourself down, just be quiet, because the world gonna tear you down anyway. So
Yeah,
don't tear
that's
yourself
very
down.
true. That's very true. Doing in the midst of what you were saying, you brought something to my attention that I am curious about. Do the process of people, we were talking about, how people can lose their teeth from, X, Y, and Z.
Mhm.
The process of getting dentures, can you kind of explain that?
So I'm sure it's different, like, because I work with a lot of Medicaid patients. So I know like state insurance vary from state to state, but here, Medicaid actually fully pay for a complete or partial set of dentures, one per lifetime. So that's like a 5-step process, 5 or 6 step process. But the first thing is getting the patient's mouth healthy. So if they're like teeth that need to come out or teeth that need restoring, fillings and stuff placed, all of that has to be done prior to starting a denture. So all the fillings have to be completed. All the broken down or non-restorable teeth have to be out and removed. So once that part happens and the gums are healing and the gums are healthy, then you can begin the process of making a denture. And the first thing is it's called like a diagnostic cast. It's just a stone model of your mouth. And then it's like a 5-step process that the lab does. And so most times the patient is just coming in and you're just trying different parts on the framework. Sometimes it's metal framework. Sometimes it's just resin. So it's like gums. It just looks like gums without a metal base to it. So you place the you get a model of the mouth, and then you send that model off to the lab, and they construct the framework. They send it back 3 to 4 weeks later. You try that in the patient's mouth just to make sure it kind of fits in the space. You send that back. They send it back. The lab sends it back with like the gum part. It's just wax. You sit it in, you place it in the patient's mouth, and then you make sure the patient can close their mouth fully with it in their mouth, top and bottom, if that's what they have. You make sure that they can say certain words. The ones we try to go with is like just 55, 56, 57, Mississippi, things like that, making sure they're not like slurring their words or have a lisp or anything like that, and that nothing is pinching when it's in their mouth. And so, like I said, it's wax. So you actually, the dentist is the one that's kind of shaping that part. Once it's to the patient's liking and it actually fits, you send that back to the lab. The lab sends it back with teeth, try it back in, make sure, once again, they can say certain words with the teeth in, that they can, lift their tongue up and down, side to side, different things they have to do. There's different materials that play a part in it as well, but that's like the main focus is that they can do and say certain words and things with it in their mouth. Then you send it back for the final delivery. So send it back to the lab harden it up and polish it up and whatever it is they do to it, then they send it back. Most times you can deliver it once it comes back from the lab on that final, on the final delivery, but there's times where it does have to get sent back to the lab because something's not right, whether it just doesn't fit, or sometimes the dentist can kind of shape it in the lab. I mean, in the lab that's in the office, but other times you got to send it back and get them to kind of correct things on it. Or the patient can just use the poly grip or something to make sure it stays in their mouth and different things. But their ridge itself plays a part in like the retention and the denture just staying in their mouth. The one thing that I will say, and this is like pertaining to younger people, 30, 40, 50 years old, don't just go to get teeth pulled out. If you can save your teeth, try to, because like I say, like they got to last you a lifetime. And then people are just like, oh, just extract it. I can't afford a root canal. I can't afford this. I can't afford that. But not even trying to do like sliding fee scales or, which is like reduced discounted price, or, paying on it every month, things of that nature, having it financed through, I think it's Care. I can't remember what it is, Care or something. But I say that to say, when you get a denture, when you get teeth pulled out and you get a denture, your ridge starts to resorb, like the bone under your gums start to resorb away because there's no tooth kind of keeping that bone there. So once the tooth is gone, that bone goes away. So a person that has no teeth on the top or no teeth on the bottom, they're like 40 years old. And then they go get a denture. And then 10 years later, they're like, my denture doesn't fit anymore. That's because your bone is going, like it's receding. So then it's like, oh, I need a new denture. Then they get a new denture fit. And then 5 years later, that denture doesn't fit. And they're upset. I don't know why my denture doesn't fit. The dentist did something. Dentist did something. No, your bone is receding because there's no teeth holding the bone in place. So that's why you see people with no teeth and their mouth is sunk in, their chin is pulled forward, their nose is pulled forward, because the bone is just going away and everything is just kind of shifting forward. And it makes you look older than what you really are. So That's the thing that I would like to say to our community is to save as many teeth as you can and don't just get teeth pulled out just to get them. Oh, my tooth hurt, take it out. No, that's not the route at all.
Exactly. And I definitely appreciate that. Like I said, I'm just so happy for you, everything that you accomplished. And it's just amazing that, I really don't think I've seen you since the early 2000s. And, we're sitting here talking about teeth. Like God is good, and it's just a blessing in itself. So I want to kind of switch gears a little bit before we wrap it up. I wanted to know, like, what made you relocate, or like, was relocating something that you always wanted to do?
Um, Relocating wasn't necessarily what I wanted to do. Um, so when I went off the undergrad, I mean, I was still in North Carolina. Grad school was still in North Carolina. Um, I only left North Carolina when I went to dental school, and it was like I said, I went to Howard in DC, and it's like once you get out of like your hometown, you kind of see like things differently. Even just going from Greenville to Raleigh is a huge difference.
Yeah,
Job opportunities, just schooling, everything is just like different. But once you leave like the state, and you come across like people from all over, and then going to a metropolitan area like DC. I'm not a fan of DC. I'm gonna say that because I'm used to greenery. I'm used to, North Carolina is a very like green,
right,
grass, trees and stuff. DC is not that. It's the mini New York is what I like to call it.
right,
Rats around in the streets and stuff. But I had to get used to that. DC is loud. DC is very loud. Lights everywhere, sirens, because like hospitals, multiple hospitals are, you know, around. So very loud is another thing I had to get used to.
right,
But there are a lot of opportunities in DC, or just like I said, with just leaving your hometown and your state in general. You meet a lot of different people from different areas, and I think I'm most grateful to end up going to Howard, but more so just being in DC and just coming across like different minds,
right.
um, like just meeting different people. And honestly, it narrows down to that. Like once you're gone, and you go back to visit, and it's almost like, not to say you want to down the people that's home, but it's like y'all still doing this, like,
Yeah,
but also see it as they haven't seen anything different.
exactly. So that's why I always encourage people to go different places and try different things. Because, like you said, it is sad that some people are, I like to call it the quicksand mentality. Just stuck in the same place. So I definitely can agree with you on that. And once again, ma'am, I want to thank you for being a part of this. And before we wrap things up, could you please say your title one more time for my viewers?
So it can be said two different ways. It can be, you know what? Here we go. Markia Camper DDS, or Dr. Markia Camper.
All right.
DDS stands for Doctorate of Dental Surgery.
All right. I definitely appreciate you. And this has been another edition of Queens of the City. More to live for. Thanks for watching.
Thank you.
Thank you, ma'am, for being a part of this.
No problem, Ernest. Thanks for seeking me out and, allowing me to be a part of this. Hopefully you girls can appreciate it, and I guess whoever else comes across it.
I definitely will. Peace and blessings to you, ma'am. You
See
and
you.
yours.
Christina said, hey, haven't seen her in forever either.
I definitely will. I definitely will.